Hello, my name is Sammy Wakefield, an occupational therapist and the inventor of Hammie. Welcome to this instructional video on using Hammie to teach about the influence of hip flexor muscles on seating and positioning. As I described in the video introducing Hammie, the pelvis, its position and movements, ripple up the spine and have profound effects on human body function. Very often, problems with head, trunk, or lower body positioning can be traced to inadequate understanding of the influence of multi-joint muscles on pelvic posture and its impact. We must understand these dynamics in order to appreciate their impact on pelvic posture in sitting and lying. This video focuses on the hip flexor muscle groups. It's imperative to understand their influence in order to achieve the most functional postures and prevent needless body shape distortions. Hip flexors include a number of muscles. To simplify understanding the pelvis and its impact on sitting and lying postures, we discuss only the multi-joint hip flexors. These are the quadriceps and psoas major. These complex muscles join the femur and the leg below the knee to the lumbar spine by way of the pelvis. Shortened hip flexors are obvious when a person's hips cannot straighten fully and they have lumbar lordosis in supine lying. This is likely to be a current or potential issue in people with muscular dystrophy, spina bifida, and other conditions characterized by low tone in the trunk and weakness. These individuals often collapse forward because of trunk weakness, and they spend a lot of time in the seated position out of necessity. The hip flexors then lose flexibility, becoming shortened. We will first discuss the quadriceps, a four-muscle group at the front of the thigh that flexes the hip and extends the knee. Now let's let Hammie demonstrate what happens with shortened quadriceps. The quadriceps muscles go over the front of the hip and the knee joints. To do this demonstration, I begin with Hammie's seat block horizontal, the lower position. Seat Hammie in a neutral pelvic posture with no rotation or sideways tilt, and the cord locks release to the ends of the cords. The left leg is set up to show only the hip flexors and the right to show only the hamstrings. So as I demonstrate one leg, I'll let the other one follow along in the same position. The spine has gentle low and upper back curves, with the head upright, with the eyes looking straight ahead, with the eye line parallel to the floor. As a multi-joint muscle group, the quadriceps flexes the hip and straightens the knee. When I shorten the quadriceps, bending the knee will pull the pelvis into anterior tilt. Bending the knee too much pulls the pelvis even further forward, and his trunk and head follow. Gravity will trigger head righting reaction to maintain proper head orientation for vision. The neck may bend backwards so the eyes can look ahead instead of down. Or the body compensates by increasing lumbar lordosis. Or both. Now let's discuss the psoas major, which joins the upper and lower parts of the human body. It attaches the femur to all the lumbar and the lowest thoracic vertebrae. The psoas primarily flexes and externally rotates the hips and also stabilizes the lumbar spine when there's sufficient abdominal tone to counteract its pull. Wheelchair users with shortened psoas often sit with external hip rotation and sometimes extreme lumbar lordosis in addition to anterior pelvic tilt. Now let's use Hammie to demonstrate what happens with shortened psoas major. Your Hammie may or may not have pink cords representing the psoas. Regardless, you will be able to do this demonstration. The psoas goes from the low back over the front of the hip and attaches to the femur. Seat Hammie in a neutral pelvic posture with no rotation or sideways tilt, and the cord locks release to the ends of the cords. We're still using the left leg to show the psoas, and as I demonstrate one leg, I'll let the other one follow along into the same position. The spine has a gentle low and upper back curve and upright head with eyes looking straight ahead. When I shorten the psoas cord on the left leg, it pulls the pelvis forward into anterior tilt. When abdominal muscles are weak and unable to counter the action of the psoas major, lumbar lordosis will increase. When the pelvis is tilted forward, the trunk and head follow. Gravity will trigger head righting reaction to maintain proper head orientation for vision. The neck may bend backward so that the eyes can look ahead instead of down. Or the body compensates by increasing the lumbar lordosis. Or both. In supine and prone lying, a person with shortened hip flexors cannot straighten the hips. If not addressed, this can eventually lead or contribute to hip joint problems as the body flattens under the influence of gravity. In prone, without adequate range in the hip flexors, the joints may be displaced out the front. In supine, gravity will pull the legs toward the support surface as well. The legs are more than 35% of body weight for adults and will seek support until they find it. In supine and prone, the hip and knee joints are stressed. Side lying with hips flexed is a common compensation, but over time will increase the problem of shortening. Now let's look at how to address the problems that Hammie has shown us. In sitting, we facilitate posture for active participation and protection of vital functions like breathing, swallowing, and digestion. It's best practice to accommodate shortened hip flexors together with focus on well-aligned upper body posture and function. Hammie can demonstrate accommodation strategies to use when a person has shortened hip flexors as follows. Stabilize the pelvis with a contoured seat cushion. Support the back of the pelvis with a back cushion, if possible angled to encourage a more posterior pelvic posture. Add a pelvic belt angled at the ASIS to limit anterior tilt. Encourage posterior pelvic posture if there's flexibility. And 4 points of attachment often work well. Reduce tension in the shortened psoas major by allowing slight external hip rotation. Relax tension on the quadriceps by extending the knee. If a person has shortened psoas only, allowing feet to be tucked toward the seat may help stability. Now provide trunk and head support suitable for function, improving alignment as much as possible. What can we do to improve shortened hip flexor range of movement? 1/3 of each day or more is spent sleeping in bed. In supine lying, gravity can be harnessed to correct postural problems caused by shortened hip flexors. Gravitational forces applied consistently can help reduce lumbar lordosis and straighten knees and hips gently over time at night while there are no activity demands. Hammie can demonstrate this as well. Try these techniques. Support the hips and lower legs with as much midline orientation as possible, allowing some external rotation. This relaxes both the quadriceps and the psoas. Knee and leg supports should be compressible to allow gradual straightening with firm lateral support. Soft support beneath the lumbar spine can be placed to reduce low back strain, while allowing gravity and muscle relaxation to provide gentle correction. The leg supports may need to be quite high for relaxation effect, but over time may be gradually lowered as soft tissue stretches. A good cue is flattening of the low back toward the support surface. Level the pelvis if necessary, correcting any rotation or obliquity that may be present. Place lateral supports at the hips and trunk beneath a fitted sheet, promoting symmetry and midline orientation while distributing pressure through a large portion of the body. Support the head and the feet, floating the heels to prevent too much pressure. I used Hammie to demonstrate how shortened hip flexors affect the pelvis and therefore the posture and function of the entire body. I've not discussed in-depth seating and positioning specific to the trunk, head, and upper extremities. These can only be properly addressed once pelvic posture issues are analyzed and understood. Hammie also demonstrated nighttime therapeutic positions specifically limited to shortened hip flexors affecting pelvic posture. This does not provide in-depth instruction about 24-hour postural care and management. Specific techniques for upper body spine protection and restoration, temperature regulation, sleep hygiene, and other aspects are necessary in order to provide safe and effective interventions at night. See resources at www.posture24-7.org for further information on some of these topics.